Dude, I was like, communist China is not happy, dude. Trust me. Like, when I tell you communist China is not happy, you'll realize. I was like, communist China is not happy, dude. I know everybody's like, dude, you say so much about China. You talk about China all the time. Or maybe they just get tired of it. They're just like, dude, we're starting not to even care that China's on the Epstein list. I'm like, really? I'm like, that's kind of messed up. I'm like, that's pretty messed up, dude. You don't care about communist China? I'm like, what the heck, dude? Anyway, so, Saudi Arabia, you're gonna have a hard day eventually. Should we just add Saudi Arabia on there very fast and very quick? We probably should. This is the first one that comes up to this, because you see all those other hashtags, so we're not playing around. Dude, I'm like, hold on a second, because there was a specific name, a specific sound that came up. If I'm not mistaken, no, I don't think it's that guy. No, nope. We gotta make sure we get the right person, dude. Get the right person. Because I'm not playing around, dude. Sure, I could put all of them on there, but nah. I was like, nah. I was literally like, nah. Alright. Should be it. Alright. Hold on a second. Let me see. Wait a second. This Mr. Defense. Dude. The side of my stomach just feels terrible right now, dude. Like, it literally feels like a tumor grew overnight after the CAT scan that I got done at UCLA. And basically, UCLA is basically the only place I could get medical attention nowadays. Mr. Defense. Yeah, we're just gonna wait, hold on a second. Hold on. Because I just want to make sure. Okay. Say no more, dude. Say no more. Say no more. Say literally no more. Say literally no more, dude. Number 54. I can't wait to get to number 67. I'm like, who's gonna be number 67? 67 also means like everybody like dip out, everybody leave, because like somebody might get caught like doing something bad, or like there's a nerd that is like saying too much. It's basically a code word. It's basically a code for college students to basically be like, oh dude, we gotta leave. There's somebody like whistleblowing in our college and he's getting us all in trouble, sort of. It's kind of complicated. South royalty. Minister of Defense. He's the Minister of Defense. You can't say that. I'm like, they could come up to my doorstep, get it? California is my city. You see what I put on here? Look at it. Evolved. I was like, yup, you know what? This isn't just the Epstein list. No. Now the Diddy files official. So anybody who's like, man, dude, we didn't really get to hear about Diddy. Oh, fudge, man. Nope. I got you, dude. I got you. That's why Diddy got to, beat down on a woman inside a hotel. Very luxurious hotel. And meanwhile, there's some, Hispanic guy, that just watches it all go down. He doesn't even stick up for the woman because, even if he's big and bad with the biggest muscles, it doesn't matter. He was cartel, so he's like, man, I'm not trying to get caught up with my people, and I'm not trying to have anything happen to myself because, this Diddy guy is basically black to non-African American cartel. I was like, yeah. Speaking of cartel, Joaquin Guzman. Nemesio Usugara. How do you say that last? Cervantes. Nemesio Usagara Cervantes. Porque sí. Etalito Eptinante. Alright, let's keep going. Hogan Levis. Or Lovis. Loveless. Whatever, however you say it. Global law firm. Okay, let's keep going. David Moltzer. CEO of the world's first smartphone at Samsung. Samsung? I'm like, whoa, UCLA. You know you work with them. Come on. You don't have to keep looking it up. You still want to know either way? Are you sure you want to know? Bro, hold on a second. Let's just watch a little thing I got in my recommended for YouTube.
These cops pulled up, all high and mighty, for some guys with a camera. So they walked up tough, but left doing the walk of shame within seconds.
There you go, Westminster Police Department.
Did you hear what he said?
Did you guys call?
Yeah.
Did you?
I think the DMV called.
Okay. Can I get a driver's license from any of you guys?
Am I driving?
Okay, so what is it that
They're
you guys
crazy.
are doing?
That's none of your business. Are you gonna size me or something that you put in all your gloves?
Let's go. Send it.
That's what I thought. Walk away.
Walk away.
Yeah.
Don't be a tyrant.
Yeah. You ain't got no. You got nothing, huh? That's called a walk of shame, daughter.
Walk of shame.
Walk of shame.
These cops pulled up, all.
By the way, if you didn't notice, there's 4, LAPD helicopters, a bit more, whatever. So I'm like, why are they all outside? They're obviously not looking for any criminals. And then I'm like, wait, hold on a second. Even if they could be looking for criminals, there's something bigger going on here. And then I'm like, oh, fudge. California and Los Angeles is Trump-controlled opposition. Because Trump can have a hand in anything, you know what I'm saying? So anyway, the reason why there's all those helicopters is because Kodak Black. Controlled weather. You really don't believe me? Excuse me, sir. Wow. Are you serious right now? Oh my gosh. That's how you know UCLA is literally spying on my phone. I mean, like, really. Wait, hold on. Let me just Oh my goodness. I'm like UCLA, UCLA, UCLA. View. Oh my goodness. A date modified, date created. Just want to make sure you see. What is this? Oh. Yeah, we already get it over there. Zuckerman, state government, where is it, dude? Where is it? It's somewhere right here. Dude, I'm literally like, yo. Dude, I am. Hold on a second, because this is getting.
These cops pulled.
This is getting kind of spooky, and I have a very big feeling that my mom is like making sure that I don't put certain kind of content out. So let me just make sure I see. Okay, so this is one day though. September 16th, okay? Dude, I'm not gonna lie, I'm kind of getting worried. Dude, I'm like, what the heck? Crazy, God bless. September the 16th. Oh, I'm like, ooh, this is gonna get crazy. Look at this. Weather modification. It's crazy, I don't even know what to say. Weather works. Crazy. Look at this. Polar vortex. I was like, so you're telling me that the polar vortex went through Brentwood when I was literally, you know, trying to fall asleep? That would happen. I want to be on that wheelchair. I want to be on that wheelchair. I want to be elder, you know, because I'm an elder and a child at the same time. Autism. I'm like, don't let me use the bathroom, dude. Ban me from you know, I'm not even gonna say anything else, dude. That's going. Can I leave this stuff out here? Because I have to use the bathroom. I gotta have you search it after. Yeah, I could empty out my pockets and let you do the wand, but...
Seems like they hold a routine.
Yeah, so... That... What else do I have? This...
Alright. Keep your arms on, relax.
Oh, okay.
Face me, please. You're good.
Appreciate it. I'll be right back. Alright, thank you. Got my survey. I think it's only fair to, like, you know, give credit where credit's due. Not something sarcastic like all due respect. It's something that the cartel would say. They'd be like, hey, you messed up the Spurs messing with our TS escorts, eh? We're going to make sure your healthcare ain't, you know, good or adequate for you. And we're going to work with every kind of gang you could think of. Even the European mafias. Or the non-black to African Americans, eh? Don't get me started about these Pacific Islanders and these Asians, eh? Oh my gosh, shoot. Oh my gosh, shoot. Those last few, you know, uploads. These two, by the way. These two. I'm like, oh yeah. These two, by the way, I'm like, I had to switch the what do you call it? The title. But I had to do it. You know why? Because my mom had me experiment, bro. Like, don't you understand? For autism. I'm not jealous at all. Think I'm gonna be jealous because I'm not a certain skin color I want to be. Think I'm gonna be jealous because I didn't get to choose what religion I wanted to be in, especially, you know, that my family didn't want me to be in any religion or have any faith. Thought I was gonna be jealous because I didn't get as good healthcare as anybody else. Thought I was gonna be jealous because I wasn't gonna be able to have the dream job I wanted. Thought I was gonna be jealous because you knew that, like, I wasn't gonna be accepted into the college I wanted to go into. Thought I was gonna be jealous because you thought I was gonna get mad that I would get my dog taken away, you know, and no animal activists or rights, you know, helping me have my dog back, plus not getting any social security and not getting any financial aid and not getting any food assistance. I'm like, nope. Somebody was laughing in the corner, but like not really even the corner. They're like laughing from high society to low society. The Thulu Society. Oh, sorry, Viral Society. Viral. Viril. Viral Society. Sorry. Oh, wait. The Shabbat. The Masada. Is it the Masada or Shabbat? You gotta choose one or the other. It's no in betweens. The cartel. The Korean or Chinese mafias, or like the Yakuza. Ooh. I haven't really been anywhere else besides, you know, Santa Monica and West LA, so best believe they're laughing somewhere. Anyway, God bless everybody.
Abscesses in your face.
I mean, why did they want to do a second CT scan after they did the first one yesterday? Then,
Oh, they offered you a second CT scan?
yeah, they wanted to try to do a CT scan of the face, but I didn't do it because I didn't want to have that much radiation dealt to me after,
Okay.
all that. And
Okay, so now you want the CT of your face?
I mean, if I mean, I'm not sure how that's going to change me having another CT scan. How that's going to change my ability to receive the surgery that I need.
So I don't see any types of abscesses there. From what you're explaining and reading the notes from the last couple of days, sir, it says that you're saying that they have abscess, but the prior teams and myself are not seeing any abscesses. So the only way to find it is to do some imaging. So I guess that's why the team offered you.
Well, I mean, I don't want to have to be dealt radiation if I'm not going to receive, like I said, the surgery that I need.
So they wouldn't be, we would have to find it first. If you're saying that there's an abscess and we're not seeing any abscesses, sir.
Yeah.
If you're saying that there's an abscess and we're not seeing any abscesses, we would have to do some imaging. Are you having any fevers?
Yeah, and I've been having on top of fevers, just a lot of pain in the stomach and chest.
Okay.
Yeah.
All right.
Sure.
So what would you like to do? Would you like us to do a CT?
I mean, am I going to be able to, have the surgery that I need, especially
I'm
emergency
not.
situation?
I'm not 100% sure that there's any abscess there that's causing your symptoms. To be honest.
And if it's so,
if the CT, I can go see what this prior CT showed yesterday, but from my understanding, it didn't show any concerns for an abscess.
Okay, well, I mean, like I said, I mean, I don't need a CT scan to know that there's some sort of contact there.
Okay.
It's physically there. You could see it.
Yeah.
I mean, even without.
You can see it
Yeah, I mean, look at that.
right here.
Yeah. Yeah. Oh my goodness.
Here,
yeah,
let me go get an
actually-
ultrasound. I'll be right back.
All right. Thank you. Sure.
Here, this is how it would look.
Okay.
There's nothing there.
I mean, but I thought they never took a image of my face.
They were able to get the sinuses in when they took a CT venogram yesterday. They were able to see your sinuses and also noted no abscess on the CT. Okay, so there's nothing there that I can see. Nothing on ultrasound and nothing on CT.
I mean, yeah, I mean that doesn't make sense.
Yeah, do you have a primary care doctor?
Yes, I do.
Can you follow up with your primary care doctor?
I mean, it's very hard for me to just get an appointment.
Okay.
For that, and I just wanted to see if I could have had it taken care of.
There's nothing there to take care of, though, sir.
I mean, I'd really like to get a second opinion on this.
Okay, I can talk with my supervisor.
Okay.
And go from there.
All right. Dude, he doesn't want to freaking sleep. It's very financial. Very financial right there. Do you leave any of that ultrasound gel? No, you didn't. Whatever. God bless everybody. contact because that's what a dentist had told me.
Okay.
And you could see that it's kind of like bulging under the eyelid.
Okay.
And this is after a tooth was extracted near the sinus, and it was impacting the sinus for about like anywhere from like a year to about like 6 months.
Okay. Going on for a while.
Yeah, until it was finally removed around like June the 30th, 31st. And
So you had a tooth removed at the end of June. Is that what I'm understanding?
Yes.
Which tooth was removed?
It was the upper.
Can you show me in your mouth? Can you show me the hole where it was removed?
Yeah.
Which one?
It's all the way to the back.
Ah, okay, got it.
Wow.
Okay. And got it. Is it painful there right now?
Yeah.
Okay. Can you move your
Oh,
feet? That hurts right there?
Yeah.
How about there?
Oh goodness, yeah. Oh,
Okay.
yeah.
How about that?
Yeah. Oh shoot.
That hurts there too?
Yeah.
How about over here?
Not so much, no.
Okay.
No.
Can you open?
Mm-hmm.
Okay, I don't see any pus coming from these there. Can I have you sit up forward for me?
Sure. Oh shoot.
Okay, sorry.
Shoot.
Can I have you sit up and put your face straight for me? Let me just take a look and see. Okay, close your mouth for me.
Okay.
Gotcha. Now open your eyes. Look at my nose. Open your eyes really wide.
Also, it does feel like there's air that goes in on that right side.
Okay.
And there also would be problems even speaking or swallowing at times.
Is there pain in here?
A little bit, yeah, on that right side. Oh yeah. Oh my goodness.
But that's where the worst of the pain is.
Yeah. Oh, man. Yeah, it hurts.
Gotcha. Does it hurt in here?
Oh yeah. On the right side, yeah.
Okay.
Yeah.
How about over here?
Yeah.
100%. Are you having any discharge coming from your nose?
Sometimes, yeah, it comes and goes.
Tilt your head back for me. Okay, gotcha. All right. Well, I'm sorry that it's causing. There's clearly some inflammation there, but I want to reassure you, I don't see any signs of an abscess or anything that we can, like an infection that can be drained out of there. What I think is going on is I think that the nerve is inflamed.
Oh. Is it possible that it's just like, instead of it being an abscess tumor, it's food?
But no, I don't know how food would be able to get all the way up there. I don't see. I think it's just a residual nerve pain.
Residual nerve pain?
Yeah. Have you been taking any medicines for pain control?
Yeah, I mean, I've been taking all that, even the antibiotics, and it hasn't swelled down at all, so.
What pain medicine have you been taking?
It's been ibuprofen.
And you've been taking how much?
I believe it's anywhere from 600 to about like 300 at least. I think it's 600, if I'm not mistaken. It's a pretty big pill.
And how many of those do you take every day?
It's about like 3 or 4.
And for how many days has this been going on? How long have you been taking 3 or 4 ibuprofens each day?
It's been about like 2 months.
Oh, wow. Okay.
So yeah, it's not slowing down or anything.
Yeah.
And on top of that, I get, mouth sores. I get tongue pain sometimes. And, yeah, just a whole bunch of stuff. So I don't know if I need a second opinion, seeing what this is or something like that. But yeah.
Yeah, have you been, let's see, do you have a primary care doctor?
Yeah, but I mean, I'm not getting, an appointment to have this taken care of until like October the 21st, which even then they're going to do an endoscopy, and I don't know. I'm just trying to see.
And which
what this
doctor is going to do? Is it like an ear, nose, and throat doctor who's going to do it?
Yeah.
Okay.
Yeah.
And where is that? Where is your?
That's like around like La Alhambra.
I see.
Yeah.
Got it.
Or La Brea, excuse me. Yeah.
Okay. Well, unfortunately, like, you know, we're kind of limited here in emergency to just, you know, like we can't. I want to reassure you that, because, you know, we the CT scan that you had yesterday, you know, doesn't see anything abnormal in there at all, which is good. So that definitely, so yeah. So I think that I don't think that the endoscopy is going to find anything abnormal, but I think it should be done, you know, just to be complete. I'm not sure that just getting the procedure done is going to make this go away. But what you also need to do is see if you can have like a pain management doctor, because there are sometimes medicines like gabapentin and different things that can be done to help with this pain if we think it's a nerve pain.
I see. Yeah. I mean, like I said, I just want to see if I can get a second opinion, because this thing has been causing like a lot of infections, and honestly, I don't see why the tooth extraction area wouldn't close up all the way if it was an abscess or a tumor at that. Because
well, when the tooth comes out, you know, different people's gums heal up in different ways. But I'm looking up in there right now, and I just want to reassure you, I don't see anything that looks like an infection or any kind of tumor or residual problem. But those nerves can get inflamed, and I suspect that that's what this is. I think you have a nerve inflammation problem, and there are medicines that can help, specifically like gabapentin, with nerve inflammation, if that's what this ends up being.
yeah, I mean, like I said, I'd just like to see if I can get a second opinion or imaging or.
So I'm giving you my opinion, but no, I'm the only opinion that you're able to get here in emergency today.
I see.
So my recommendation to you is to follow up again with your primary care doc and ask about getting either treatment for a nerve pain or referral to like a pain management doctor who has experience dealing with nerve pain, because that's what I think is going on here.
Okay. Yeah. I was wondering if I could have a refill on a prescription that's been working pretty well.
Which medicine are you interested in?
Actual bottle right here. I was wondering if I could have a refill on cephalopold.
Well, this is an antibiotic.
Yeah.
So it's not even. How are you're taking this right now?
Yes. And I'm taking it in conjunction with clindamycin or.
Okay. So no, we wouldn't give repeat antibiotic doses unless we thought there was some ongoing infection that you would need to be treating with an antibiotic. So usually when those are given, you just give one course and then it's done and you get the benefit from it. But and there's good reasons to not be on long-term antibiotics, because they can actually cause you harms too. So no, I'm not. I don't see any reason. I think you should continue taking those, and then follow up and recheck in with that doctor who prescribed those to you. But I suspect that you probably wouldn't benefit from additional antibiotics beyond those, because that's a really strong one.
I see. I mean, I don't know. I just really wanted to see, what this is in my sinus, because I have a feeling that there might be something missing as far as any observation goes. But I mean, if you're the supervisor and you're telling me nothing's wrong with me, there's nothing I could do.
I'm not saying there's nothing wrong with you. I'm saying that you have a nerve inflammation problem. And nerve inflammation needs specific treatment by a doctor who's familiar with that. Again, there's medicines called gabapentin, and there's other things that can be done to treat nerve pain. But it's outside of my specialty as an emergency doctor. but so I'm not saying there's nothing wrong. I just want you to be clear about that. But I think that you need to get in. I think a pain management doctor who's to treat your nerve pain is what your solution is going to be long term.
I see, and that's if there's nothing in this sinus, if it is just nerve pain that.
Yeah, and again, I don't suspect there's anything in your sinuses. On my exam and your CT scan yesterday also did not show any kind of significant sinus disease.
Even though they only did a CT scan of the brain?
Correct, because that the scan actually images throughout your entire, it does your face and your brain. So you can see the sinuses with the brain scan.
I don't know, that's really odd. I don't know why they're demanding for me to do CT scan of the face, but that's fine. I mean, I don't think it really matters at this point. There's no need to elaborate any further.
Okay, all right. Well, it's nice to meet you. I wish you the best. We're going to get your discharge paperwork getting to go pretty soon.
Okay. Yeah. Liar.
Trying to get up, sir. Yeah, very simple. Just press that. Do you need help going out?
I mean, not really.
You gotta go, man. That's it. You've been cleared.
You've been checked. The doctor said you're good, man.
I mean, I was just asking if I could have like 10 minutes.
No, sir. We cannot let you sit.
You have been here for over 10 minutes. You've been sleeping for over 10 minutes.
You've been sleeping at least since I got here, so you gotta go, okay? Because you're up for discharge.
I mean, I was just asking if I could have 10 minutes, like as far as.
And it's best if you take off on your own, because that way when you come back, we know that you'll be okay with us. You know, we don't have no issues. You're good.
Well, I mean, I was just wondering why you let other homeless people like sleep.
No, we do not let nobody hang out. 5 more minutes and nothing.
As long as you got your paperwork, you've been discharged, you gotta go.
Yeah.
I mean, it's not hard for me to just look. I can just look outside right now.
Let's go, sir. Let's go. You can go somewhere else. You can't read here. Okay, you can just.
As long as they give you that paperwork, that's it. You gotta go.
I mean,
Because they gotta get some other patients in here right now that's waiting. So you gotta go, sir.
Let's get up, sir. Get up, sir. Do you need us to help you up?
I mean, I don't know what you mean by that.
That means I'm gonna have to help you up and walk you out.
Let's go.
Oh.
And I don't want to do that. I'd rather you get up yourself and walk.
I mean, I don't know why I'm being treated like a criminal, to be honest.
No, you're not. You're just being told that you've been cleared already. That's it.
I mean, not really. I
It's like
mean,
close to the door, so you can just walk to your bike, pick it up, and
you guys are touching my like property and
Okay,
stuff.
last time.
Yes.
Are you gonna get up,
Because
or do you
you're
want us to
physically-
get you up?
You're
Do you want us to
slamming.
get you up then?
You're slamming the
Let's go.
footrest.
Let's go.
You slam the footrest.
Sir, are you gonna get up or not?
I mean, I'm just letting you know what you're doing.
go.
you gotta go. You've been discharged. That's it. We have nothing to discuss. Let's
Yes.
go. You gotta go. That's it.
I mean, it seems like you guys want to rush me out of here for some
Let's
reason.
go.
You've been sleeping here for over 30 minutes. We cannot just leave you be sleeping here. You'll be sleeping here. You gotta go.
I mean,
Now you come back another time, that's fine. But right now you've been cleared, man. You gotta go.
I hadn't even been able to like leave on my own volition. You want to try to just
We cannot be doing this. You gotta go. We need to use this space to treat some other patients. We gotta go.
see. The thing is that you kind of made your own problem by trying to make me seem bad by surrounding me and like slamming the footrest and stuff.
Matthew, it's
Yeah.
been really nice, but you have to go. You're up for discharge, okay?
Listen,
You've been medically cleared.
whether
You're not
whether
gonna
the
see anything.
whether the medical staff have been nice, that's one thing. But these two right
Okay,
here,
then I'll have them step away, but you still need to leave. Because you've been discharged, okay?
I mean, it's kind of too late for that. He literally slammed the footrest
Are you videoing?
like a child.
You cannot video staff.
I mean, I'm videoing for my own safety. I'm not backing out.
Matthew, you really have to get up. You've been medically cleared and you're taking a spot from another patient now, okay?
I mean, I don't want to take a spot from anybody. Okay? I literally just tried to get, you know, medical attention, and
You
that's
did get
it.
medical attention and you've been medically cleared, okay?
I have not.
You have been. I just gave you your discharge paperwork where it says you've been medically cleared.
I showed you guys physically what's wrong with me time and time again, over and over again,
Okay.
and you guys aren't being honest. That's it.
Okay, well, the physicians have determined that at this time
And
you
you're
don't
just
need
saying,
any
okay,
further
well, you
emergency
just
care.
admitted it.
The
You
physicians
just
have
admitted that
determined
you're
at this time
not
you don't
taking
need
actual
any
care of me. I'm just letting you know that.
Is that what you hear?
Oh, shoot.
I think she needs a wheelchair. He needs a wheelchair. One right out there. We don't handle patients.
No, you definitely do.
No, you cannot go in there. You gotta go. All this is for patients. You no longer.
Sir, that's for patients, like we just told you. So you need to leave. Grab your stuff and let's go.
You gotta go.
Grab your skateboard and let's
I
go.
mean, as you can see, you know, like, they really let people, you know, sleep. It's just not me. It's just not me. I mean, you guys already saw last night, you know, especially with the homeless that they, you know, favor, but just not me. The guy that slammed the footrest, by the way, that's him. Definitely used to work for LAPD. So just think about it. It's like, why do they have to do a lot of convincing, you know, that there's nothing medically wrong with me? It just doesn't make any sense. They're saying that this thing right here that's literally bulging, there's nothing, it's not, you know, inflamed or anything else. It's like, it just doesn't make any sense. I didn't really want to give him a hard time, but it's like this guy's like, you know, like slamming the footrest or like, you know, rushing me out, and I'm like, why are they like doing this to me? And I'm like, I'll wait. Especially with those first two, I was like, oh man. I was like, such a waste of time. They're mad. They're like, you don't want to do the CT scan? You don't want us to give you, you know, radiation poisoning? They're like, nope, no medical attention for you. I'm like, yep, I figured so. You know? I point out how Providence Medical Center, you know, really gives me this radiation poisoning. Wow, UCLA wanting to bully me out of their campus. I'm like, oh. Stop doing drugs. Stop experimenting on autistic people. Stop medically malpracticing autistic people. Stop letting cartel work for your, you know, your school staff or whatever. Now they're just gonna keep doing it. They're just gonna double down. Oh my goodness. Gosh, that's so lame. I don't even know what to say. Ah, shoot. I still can't believe I got spotted, you know. Something to eat. I was literally just so confused. I was like, they literally didn't even give me like they didn't even give me like 2 minutes to gather my stuff after like, wait, also another thing is that they didn't even give me my discharge papers like before they even sent out, you know, the security. They basically just like gave me my they gave me my discharge papers after they literally sent security. I was like, oh my goodness. It's pretty stupid. I was like, nope. Everything that I tell them, you know, to stop doing, they're just gonna double down. It's like, you can't record staff in here. I'm like, I don't know what you're talking about, lady, and I don't know what kind of law you're trying to use to back up that decision, but best believe I'm not listening, because I'm doing that for my own safety. Man. Excuse me, boss man.
Yeah?
I hate to bother you, dude, but I was wondering if you might have had maybe like a spare dollar or two, because I just happen to be...
Sorry, I don't have any cash.
Yeah, it's okay, though. Okay.
Good luck, though.
Thanks, dude. Hope you have a good, man. Well, at least I basically predicted, you know, my own medical malpractice. You know, they weren't going to take care of me properly. I'm like, yeah. That's basically it. I was so flabbergasted for a second right now, because from across the street, like, there's this like girl with the glasses looking at me kind of weird. But then I kind of like had to do a double take, because I was like, this girl looks like she's walking next to, like, you know, these two younger people a little too closely, and I was like, oh my goodness, that's like a young Epstein mother looking like, yeah, he didn't get that surgery. And I'm like, yeah, I know. I'm like, what do you think? And that Epstein was hello, God bless everybody.